As the mayor calls for 1 million vaccinations by the end of January, we're joined now by council member and chair of council committee on health, Mark Levine, to find out what that plan looks like. Good morning, Mark. Thanks for being with us.
Good morning. Thank you.
Absolutely. Okay, let's look at the numbers right now. Since the city received its vaccine doses in mid-December, we've seen 110,000 doses being vaccinated. Why so little?
We are so far behind where we need to be. On a weekly basis, that's about 40,000. We need to be probably 10 times that, 400,000 a week, so that we can get to some measure of herd immunity by the middle of this year. And to do that, we have to start vaccinating beyond hospitals. We need to be out in community locations all over the city in hundreds of sites, in school gymnasiums or NYC community centers and houses of worship. We're going to need a staff of thousands to help make this happen. And we need to do it round the clock, not just during business hours. You know, so far vaccination has mostly only taken place during regular hours, very little on weekends, almost none on holidays. And that's just not good enough. We have to pick up the pace.
And there's a lot of pomp and circumstance about, the first person at this particular hospital to get it and this, that, and the other, which I understand. It's important for people to see the importance of that. But at the same time, we're seeing vaccinations being stored and not being administered to people who indeed need them. So you're talking about a 24/7 operation. What would that look like?
We've done it before. In 1947, New York City vaccinated 6 million people in just over 3 weeks. And this is the scale of thinking we need now. This is a warlike situation. And we need to deploy people all over the city workers. We can bring in volunteers. We have a medical reserve corps we can activate. But I also want to mention that we need more flexibility. We have very rigid prioritization right now. If a vaccine site has a few doses left over at the end of the day, they shouldn't have to throw them out. They should be able to give it to someone else.
I just was about to ask that, because when you come to this 24/7 operation, say it goes into effect, right? Is it the first responders and the medical personnel who only get in line first, and then after that, when does the regular public know when to go?
Well, so we're in phase 1A right now, which is focusing on healthcare workers and people who reside or work in nursing homes and a few other small categories. That's a huge group. But, if someone who's 75 years old and is not a healthcare worker is there to pick up an extra dose that might have gone wasted, well, great. A site shouldn't be penalized or fined for that. We need to get doses into people. We need a little more flexibility for the sake of speed.
Mark, you talk about it being wasted. There is some talk as well about having this vaccine already calculated so that they don't have to put it in a syringe and then therefore they're being part of it wasted. Do you support that, and you see that happening anytime soon?
Well, this has all been done so quickly. So right now they're given to providers in vials of 10 or 11 doses. And if you open a vial and don't use all the doses, the rest are wasted. Yeah. So in that case, just give it to someone who is high risk, even if they're not in the top priority group, an elderly person, for example. This is the kind of flexibility we need to offer sites. We shouldn't be fining them for that kind of activity, as long as they are adhering to common sense to get things out the door to people who need them most.
All right, I want to get back to those vaccination sites, because you actually did a poll on Twitter, and I want to put it up on our full screen so people can see it. 92% of people said they would go to a vaccination center at 1 a.m., 1 o'clock in the morning. You've called for this to happen in each of the zip codes. Do we have the ability to do that? Do we have the personnel to do that?
Absolutely. We can mobilize thousands of people among city workers. We have a large medical reserve corps. We can mobilize volunteers. Many people are willing to do this. Many people responded to that poll and said, not only would I be willing to get vaccinated at 1 a.m., I'd be willing to volunteer at a site at 1 a.m. So we can do this, but we have to go big and we have to go fast, much faster than we are now. We've got to get to 400,000 doses delivered a week if we're going to get to herd immunity. We are very far from that. So we really have to accelerate on every front.
Well, the mayor has said that he wants to get to that 400,000 number by the end of the month, and that would get us to the herd immunity. Does that math stack up for you? And help us understand, what is that magic number for herd immunity when it comes to the total?
Well, on Sunday, which is the last day we have data, we vaccinated about 2,500 people. So we are very, very far from the goal of 400,000 a week, and we're picking up the pace, but we've got to do much more. Yes, if experts are saying that somewhere between 70 and 85% of the population getting vaccinated would get us herd immunity. And so that should be our goal. We should be able to do that by this summer. And we're not on pace yet to achieve that. No one wants to see this drag into 2022, but the current pace we're on, that's when we would reach herd immunity, and that's just unacceptable.
Very quickly, because we're out of time, are you getting any, I guess, support from officials to making this a 24/7 operation?
The mayor himself yesterday responded to a question in the press conference saying that he wants to do it. So let's make it happen. The public wants it. The need is there. Staff and volunteers are available. Now we just have to implement as soon as possible.
All right, Mark, you'd be there at 1 a.m. if you have to, right?
Absolutely.
All right, thanks for joining us. Happy New Year to you.
Thank you.